Medicare Supplement, Supplemental, and Medigap are three different words that all describe the exact same thing, and that would be additional coverage that you can get to fill in some of the gaps that original Medicare just doesn't cover. Now, I personally use supplement plans more often. It's my personal preference, but they all mean the same thing. And of the 10 standardized supplement plans that are available to people just now becoming eligible for Medicare, Plan G is king in terms of popularity. I'm going to go over what makes it so great and what some of its weaknesses are. There are 6 significant hospital and medical gaps that original Medicare does not cover. Most people choose to get certain plans to fill in some or all of those gaps. The 6 gaps are split into 3 Part A gaps. Remember, Part A is inpatient care, and 3 Part B gaps, your outpatient medical care. So the first Part A gap is the Part A deductible. In 2023, this deductible is $1,600 per benefit period. You would need to pay this deductible before Medicare Part A begins to cover anything. The benefit period is not an annual benefit period like what you're used to. The benefit period begins when you are admitted into a hospital, and it ends when you have been out of the hospital for 60 consecutive days. This means that you could have multiple Part A deductibles in any given year. The second Part A gap would be the Part A hospital copays. If you're in the hospital for more than 60 consecutive days, you have daily copays that range from $400 to $800 depending on how long you've been in the hospital. Now, the third Part A gap would be the Part A skilled nursing facility copays. If you are in a skilled nursing facility for more than 20 days, you have a $200 daily copay up until you are in a skilled nursing facility for 100 days. At day 101 and beyond, you're responsible for 100% of the costs. Those are the Part A gaps. Now, the 3 Part B gaps would be the Part B deductible. This is a more standard deductible, meaning it's just an annual deductible, and once you meet it, you don't have to pay it again until it resets in January. It's actually quite reasonable at $226 in 2023. The second Part B deductible would be the 20% coinsurance that original Medicare does not cover, because remember, original Medicare will cover 80% of all approved Part B expenses. You are left with the other 20%, and if you just have original Medicare, there is no limit, meaning there is no out-of-pocket maximum to your 20% responsibility. Finally, the third gap would be excess charges. To understand this, we need to understand how providers work with Medicare. And there are 3 pools of healthcare providers out there. The first would be those providers who participate with Medicare and accept the Medicare fee schedule as full payment. This makes up about 97% of all doctors nationwide. You don't have to worry about anything really if you visit them. The second would be non-participating providers. These providers make up about 2% of all providers, and they have the option of accepting Medicare as full payment or not. Most don't, but they are only allowed to charge 15% more than the Medicare fee schedule as payment. Medicare would pay its portion. You would be responsible for your portion, the 20%, and any excess charges, which could be up to 15% of the billed amount for your healthcare services. This is the third Part B gap, that 15% excess charge. Finally, there are providers who have opted out of Medicare entirely. This makes up about 1% of all non-pediatric providers across the country. Interestingly enough, the largest percentage of those providers are psychiatrists. Providers who have opted out of Medicare do not agree to any of the Medicare fee schedule, and their charges to you are a private contract between them and you, where they can charge what they deem appropriate. These services, I guess you could consider another original Medicare gap, but there aren't any supplement plans that fill this gap. So why is Plan G king right now? Well, its strength is that it covers more of the 6 gaps than any other supplement plan available to those who became Medicare eligible in or after 2020. In fact, Plan G covers 5 of the 6 gaps entirely for you. It's an excellent plan. Another huge strength of all supplement plans is the fact that you can visit any of those 97% of the providers that we discussed earlier without having to worry. The Plan G lets you access the 99% of providers by covering the excess charges if you were to visit one of those non-participating providers. Finally, again, this is with all supplement plans, but Plan G allows you the freedom of coverage of original Medicare because it pays secondary to Medicare. This means that if original Medicare covers it, your Plan G will cover it, no questions asked. It all sounds great. What possible cons could there be or negatives to Plan G? Well, there are a couple. The first is the Part B deductible, and it is the smallest weakness, and the only reason it is a weakness is because there is a plan called Plan F that covers everything that G covers, plus that Part B deductible. Plan F used to be king, but as I mentioned earlier, if you became eligible for Medicare in 2020 or later, you cannot get a Plan F. So that $226 Part B deductible in 2023 is something that you'll need to pay with a Plan G. The good news about this, though, is that Plan F monthly premiums are much higher than Plan G. That $226 deductible comes out to be about $18.83 per month, and guess what? In our area, at least, Plan G premiums are around $30 per month less than Plan F premiums. So even with that small weakness of the deductible, in our area and in many areas across the country, Plan G is still a better plan financially, in our opinion, than Plan F. If you have a Plan F and you are in an area that allows you to switch down to a Plan G and you want to save a little money each month, that could be something to look into. Okay, that was one of those kind of tell me your weaknesses and then you list a strength as a weakness. So now onto the real weaknesses, and the first one that we'll talk about with Plan G is the monthly fixed cost. The monthly premiums for Plan G vary dramatically across the country, anywhere from around $100 per month per person to over $300 per month per person for a 65-year-old. These can be very expensive for seniors on a fixed income, particularly living off of Social Security and not yet qualifying for Medicaid. The average in our area is about $150 per person per month for a 65-year-old with Plan G. That comes out to about $1,800 per year in premiums, whether you use the healthcare system or not. The next weakness is related. Supplement plan premiums increase over time, and there are two ways. The first is the standard insurance increases that happen nearly every single year. Not all, but most years. Insurance companies raise premiums a few percentage points each year to account for rising healthcare costs and inflation. As a Medicare example, the first Medicare recipient paid a whopping $3 per month for Part B premiums. The Part B premium in 2023 is $164.90. So premiums increase over time. The second reason is what we sarcastically refer to as the happy birthday increase. Many supplement plans are age-based, meaning that as soon as you turn 66, your premium is now a little bit higher than it was at 65 because you moved into a higher age category. This continues for the rest of your life each year on your birthday. So with supplement plans in general, not just Plan G, you could see 2 increases each year to your premiums. Now, there are community-rated supplement plans that do not have that happy birthday increase, but they do have the other increases that occur not every year again, but a lot of the years. For our friends who happen to have a few more years on them, we have seen premiums in the $500, $600, and up to $700 per month range. We have heard of people with even higher premiums than that, again, depending on where they live, the companies that offer their plans, and other factors. The reason Plan G increases specifically are a bigger weakness than the other supplement plans like Plan N and the high deductible Plan G is because Plan G in general has a little bit more aggressive rate increases. Over the history of supplement plans, there have been plans that were phased out. I mentioned Plan F earlier. Before Plan F, it was Plan J. These plans are incredible in the amount of coverage that they offer, and since Medicare beneficiaries have a guaranteed issue right to a supplement plan when they first go on Medicare and at other various points, anyone can get these plans no matter how extensive their healthcare costs may be. This is a good thing. It also has consequences. What happens is that the pool of people who get these plans is generally made up of those with high healthcare costs. Those with high healthcare costs choose the plan with the most coverage because it's worth it to pay the extra in premiums. There are still many who choose these benefit-rich plans even when healthy, and over time, we typically don't become less costly with age, so even the healthy in that pool of people eventually start having higher costs. So stay with me here. If a Plan G currently is the most benefit-rich plan for those with high healthcare costs, the people with those high healthcare costs will flock to this plan, while others with maybe lower healthcare costs because they're a little bit more healthy will go to lower plans like Plan N and high deductible Plan G. This means that the Plan G pool of people will increase in costs more quickly than the Plan N or high deductible Plan G. This also means that the Plan G premiums will increase at a more aggressive percentage than the plans with less risk. It's probably more than you wanted or needed to know, but that is the reasoning behind Plan G premiums increasing more quickly than supplement plans with less coverage. Finally, the last weakness to not just Plan G, but all supplement plans is the fact that they only cover those Part A and Part B gaps, as we mentioned. Supplement plans do not cover things like Part D prescription drug coverage, dental, vision, hearing aids, or long-term care. You would need to purchase all of those separately with their own monthly premiums, deductibles, copays, and coinsurance on top of what you're already paying for the supplement plan coverage. So now you know the strengths and the weaknesses of Supplement Plan G. Who typically gravitates to Plan G? Well, we've covered it a bit already, and it would be those who have chronic high-cost health issues tend to go with Plan G. Also, those who hate risk and they hate the idea of having any variable medical costs love the predictability of Plan G. And those who can afford a Plan G love it. Again, because they aren't worried about the higher fixed premium costs and they enjoy the peace of mind that comes with Plan G coverage. You better believe that we'll have videos about high deductible Plan G and Plan N, so watch for those. Thank you for spending some time with me. If you found this helpful, giving it a like is a huge help to our channel, and so is subscribing. If you feel like this is something that you'd be willing to do, I'd really appreciate it. As always, I appreciate you and thank you for watching.